Good evening. How are you doing today?
Good.
Okay, can I get you to verify your name and date of birth?
Bert Olson,
Okay, date of birth?
7/26/92.
Okay, so my name's Elizabeth. I'm a student physical therapist assistant at NWTC. It looks like today we're going to be doing some re-education with your quadriceps muscle. Does that sound about right?
Yep.
Okay, so what that pretty much means is I'm just going to be hooking you up to my NMES unit. What does that stand for? That's neuromuscular electrical stimulation. We're just going to be stimulating the quad muscle so that we can re-educate your neuromuscular system so that you can better fire your quad. Do I have your consent to do this?
Yep.
Okay. So before we start, I'm just going to run through a brief health history with you. Do you have any pacemakers?
No.
Do you have any implanted stimulators?
No.
Do you have any superficial implants in your quad?
No.
Are you pregnant?
No.
Are you disoriented?
No.
Do you have any malignancies or cancers in the area?
No.
Okay, you're not actively bleeding because your skin's intact, and we're not working over the anterior triangle. Active motion is indicated in this area. You can move your thigh.
Yep.
Okay, so after that, I'm just going to do an initial assessment of the quad. So I'm looking at it and comparing to the other quad. Comparing, skin is intact. Are you having any pain today?
Nope.
No pain? Okay, pain rating 0. Checking skin for edema and swelling. There is no swelling. We're just looking to re-educate the muscle, say after you had a surgery a while ago. We can say we did range of motion, manual muscle testing, all turned out okay. All right. So now I'm going to do some tests on you. One of them is a pressure test, so I'm going to have you close your eyes. Can you tell me which one is more pressure, 1 or 2? 1 or 2?
2.
1 or 2?
1.
1 or 2?
2.
Okay, now I'm going to do a temperature sensation. We're going to do the same thing. You're just going to have your eyes closed. I'm going to touch you with something cold. I want you to tell me which one's colder. 1 or 2?
2.
1 or 2?
1.
1 or 2?
1.
Okay, you passed. Good job. All right, so we did contraindications. We did a bit initial assessment of the area. So now what we're going to do is we're going to clean the area with an alcohol swab. Okay, you're clean. Now we're going to come over here to my NMES unit. We're just going to hook you up to the electrodes. We're going to put it pretty much just over the quad. Okay, and then we're going to come here to my screen. So what I'm going to do is I'm going to get the machine all set up with the parameters that I need. So we are clicking NMES. We are choosing a large muscle since these are the quadriceps. We are doing a custom mode. We're going to do a treatment time of 20 minutes. So we're going to try for like 20 to 40 muscle contractions. So for your rate, since we're doing manual or muscle re-education, we are doing 20 to 50 PPS. But if we were doing a fatiguing, we would be doing 80 to 100 PPS. Width is going to be between 50 and 200 microseconds. So we're at 120 microseconds, and that's fine. Waveform is going to be symmetrical since this is a larger muscle, but it will go asymmetrical if it was a smaller muscle. Lag time is 0, so we don't have to mess with that. Ramp time, we're going to do 2 seconds. What that means is it's going to be gradually stimulating over 2 seconds. The stimulation isn't going to hit you just at random. It's going to gradually ramp up. Ramp down will be 2 seconds, so we'll have a solid contraction for 6 seconds. Off time is going to be 30 seconds. On time will be 10. If we were doing muscle spasm, on time would be 30 seconds, off time would be 10 seconds to fatigue the muscles. Off time, 30 seconds. All right. So now what we're going to do is I'm going to turn up the machine. I want you to let me know when you feel a tingle, okay?
Yep.
Okay. So now what we're going to go for is a muscle contraction. So we're going.
Okay.
You're contracting. Okay, so now what I want you to do is make sure you're trying to fire, like contract your quad when you feel the contraction through the stimulation, okay? So I'll press the on button. So we're going to be contracting for about 6 seconds total, 2 ramp up, 2 ramp down, and then it's going to be off for 30 seconds. So every time you feel that electrical stimulation to come on, I want you to really try to contract that quad. We're trying to recruit motor units, okay? We're going to try to get your quad to fire stronger. Now I've got a call bell here for you. And I've got a timer. I'm going to set it for 5 minutes. Do you need any draping?
No.
No? Okay. So I'm going to come back after 5 minutes and we're going to check you over and see how you're doing, and then we'll continue with the rest of the treatment, okay?
Yep.
Bing, 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 bing. It's been 5 minutes. How are you doing? Are you tolerating the treatment?
Oh.
Yep. Okay. Do you need it more intense? Do you need it less intense at all?
No.
Okay. So what I'm going to do is I'm going to set the timer for 15 minutes. I will come back. You have your call bell. Do you need any draping while I'm here?
No.
Blanket or anything?
No.
Okay. So I'll set the timer. I'll come back to bother you in about 15 minutes. Ding, 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 ding. Okay, that is the conclusion of your treatment. I'm just going to turn the intensity off and then turn the machine off. I'm getting these electrodes off. We are going to do a final assessment of the area. So do you have any pain at all?
No.
Okay, skin is intact. Comparing to the other thigh, it doesn't seem that there was any irritation either from the adhesions, from the electrodes. There isn't any swelling. We can say we do range of motion, manual muscle testing, that he passed. We can report to the supervising PT that we position the patient in supine, long sit. We place the NMES electrodes on the quad, one proximal, one distal. We would say that we set it for 50 PPS for muscle re-education, 10 seconds on, 30 seconds off with 2 second ramp up, 2 second ramp down. Patient tolerated treatment well. We'll continue to use for further neuromuscular re-education. That's the conclusion of my treatment.